Hello and good afternoon, everyone. My name is Andrea Barrett, and I am a healthcare consultant here at Microsoft. I'm also a physician assistant, and I'm excited to show you today how you can streamline your documentation by using our DAX Copilot solution. And today we're going to go ahead and also focus on some new AI features that allow you to seamlessly and intuitively interact with the AI output so that you can transform the content and complete all of the additional required tasks on a patient all at the point of care. So let's go ahead and get started. So today I'll be performing an orthopedic encounter with my patient Julie, who's given full consent to use DAX Copilot. So Julie, as you know, we're going to be using this technology to help with my documentation today. Is it okay if we go ahead and get started?
Absolutely.
Okay. Julie is a 35-year-old female who comes in today with complaints of some left knee pain. So Julie, tell me a little bit about what happened to your knee. What brought you in?
Yeah, so thanks for seeing me, first of all. I love soccer. I'm in this indoor league, and I was playing, my typical game last week.
Okay, so I can see that my note is back within my mobile application. If I want to do any edits within the mobile app, it's easily done just by hitting this edit button here. And this is really nice. I can just go ahead and go from room to room while looking at this note and making any edits on the go. But let's say that I'm now back at my workstation and I want to go ahead and start reviewing this note so I can move it into the EHR. Here I have my DAX Copilot window open. And this is, let's just go ahead and review this note while we have it here so you can see how easily it was for me to capture that documentation, that natural conversation with myself and Julie. Looks like the note did a really good job of capturing all of her symptoms. We asked questions all throughout that conversation. The natural language engine is able to parse out that information accordingly into the appropriate sections. And it got all of my assessment and plan for her. I'm going to go ahead and leverage some AI capabilities by pressing my DAX Copilot icon here. One of the features that I like the most is being able to configure my style. So let's go ahead and talk a little bit about this. We know that being able to customize the AI output is extremely important to clinicians. So we want to be able to allow them to do certain formattings of their AI output. Now to do this, I'm going to go ahead and set my style. The auto style I'll talk about in a minute. But by doing this, I can go through and essentially customize how my AI output is visualized when it returns within the mobile app as well as in the DAX Copilot window. So do I want gender-specific pronouns, gender-neutral? This is section-specific. So for the HPI, do you want it in paragraphs or do you want it in a bulleted list? Every clinician is different. Do you want the language standard? Do you want it more colloquial or would you like it more formal? I can insert any additional text if I want, and I can go through all of these 11 different sections of the AI output. Social history, do I want it paragraphed or bulleted list? One of the things that I like the most is my assessment and plan. So I like my assessment and plan in a bulleted list. And I like to number each diagnosis. I typically like the DAX output, so this is how I like to set up my format style. So I'm going to go ahead and hit save. And then I'm going to go back to Copilot and show you how this can be applied. And now I'm going to hit apply my style. Now, I do have the capability to auto run my preferences automatically at the time of the encounter. So for my assessment and plan, again, this is all I picked. Now my list is in a bulleted format, which I like. It's numbered. All I have to do is hit apply changes. It updates automatically within the clinical summary. I can move this information over into the EHR and sign my note. Let's say I want to change the pronouns. This is really nice for any non-binary patients you might have in your practice or for patients who identify other than what's listed in the EHR. So by doing this, if I click on this, it allows me to change the pronouns to he, him, she, her, they, them. Let's say I want to change the pronouns to they, them. So here Copilot has analyzed that information and come up with changes for me to review. So I can see here that all of the pronouns have been changed all throughout the HPI, as well as the assessment and plan. And as I review this, I can go ahead and hit apply changes, and it will update automatically within the clinical summary for me. And then I can just move this information over directly into my EHR and sign the note. It's that easy to go ahead and complete a full encounter all at the point of care. Let's go ahead and get some coaching on how I can better improve my AI output. This allows my documentation to be more robust, and DAX Copilot is analyzing all of this information, and it's looking for any gaps in my verbalization. So it comes up with this information directly within the DAX Copilot window, and I can just read through these recommendations, and the next time I see a patient, I can use this coaching to better improve my output. Okay, so for example, Copilot has identified some areas in which I can improve my documentation. It does acknowledge, though, that my documentation is overall pretty good, but let's look at a few areas that we can add additional clarity. It really thinks that I should include more information about the patient's past medical history, their social history, family history, again, to make my note more robust, to improve that reimbursement and that documentation going forward on the patient. And it's also asking me to include more specific information about the mechanism of injury, including the direction and force of the twist, which, this is all really good information. This is important information for orthopedics to include in their notes. And so I can go ahead and take this coaching instruction and use it on my patients to further improve documentation going forward. This would be really nice to leverage AI if you have a really busy day. Even though these notes are coming back quickly, I may not have the opportunity to review them right when the patient leaves, depending on what's going on. This allows me to take a really complex encounter that I might just be reviewing for the first time after a few hours. And here, Copilot is able to generate this summary for me so that I can just remember, okay, yeah, I saw Julie for this knee pain. It just bulleted all of the things out for me that I just have to remember to order her MRI, her physical therapy, her weight bearing, all of these things. And I'm able to just refresh this so I can edit the note appropriately, put it into the EHR, and sign it. Okay, now let's go ahead and leverage AI to help me summarize the diagnosis evidence. Now, this feature is really important because it allows me to validate the information that the AI generated from that conversation and what it placed into my clinical note. So when I hit this button and it takes that information, analyzes both the subjective and objective findings within the encounter to present the evidence to help support my medical decision-making and coding. So let's just go ahead and scroll through this. I'll start at the top here. So for her left knee pain, it's bringing up all of this information, the clinical observation, so that's that objective data, my medical decision-making. And so the transcript is essentially the automated speech recognition from what I said and what the patient said. So this is a really good way to verify exactly what happened in that encounter, to verify that output. And just by clicking on this information, it brings me directly to that area within the transcript for me, so I don't have to scroll through the whole thing. And this is just, again, another efficient way to handle all of this at the point of care to make it easy for me to sign the note and move on to see my next patient. So let's go ahead and draft an after-visit summary. Now, by drafting an after-visit summary, I'm able to add in specific encounter information for the patient and the patient's family to reference while they're at home. This is a great way to augment the information that's coming from your EHR that might be you can easily move this information into the after-visit summary so the patient can see it in the patient portal later, or even print it out for them to take home to reference. So it's an easy to read language for the patient. So let's just take a look at this. I'll start at the top here. It gives her patient demographics, tells her what she came in for today, talked about, my clinical findings on her, as well as the treatment plan that we're going to be. So again, I gave her a laundry list of things that I needed for her to do. And this is a great way for her to remember that she's going to get a crutches and a knee immobilizer, and she can take some ibuprofen, but also alternate it with Tylenol. And again, these are encounter-specific instructions that can be added on, and she can very easily just reference these while at home. So let's focus on drafting a referral letter. Now, as an orthopedist, this is important because my documentation doesn't end with the clinical note. So by clicking on draft a referral letter, this really helps to save me time so that I'm not duplicating work and dictating this information all over again. I'm able to, let's just start at the top here. We can go through this. I'm writing about my patient Julie. She experienced some knee pain. It talks about my physical exam. It talks about my concern for an ACL tear, and then it, of course, includes my recommendations that she might need ACL surgery and what I'm going to do for her right now. And so again, this just saved me an extraordinary amount of time by, again, preventing me from doing duplicative work and dictating this into a separate document.